I'm Abby Goldstein. I'm going to be talking to you today about youth and emerging adult-focused mental health care, a developmental perspective, to give some context to thinking about how we can provide youth-oriented care. I'm a clinical psychologist and a professor of clinical and counseling psychology at the University of Toronto, and I'm looking forward to sharing some of the work that I've done around understanding mental health services from a youth-oriented perspective with you today. I always like to start with just giving a bit of context in terms of thinking about the challenges with transitioning from childhood to adolescence and then to adulthood. And I think these quotes do a really nice job of highlighting some of those difficulties. And oftentimes that desire to stay in childhood and hold on to what childhood is about, because it can be challenging to move into those new stages of development. In terms of our learning objectives for today, I hope that at the end of this session, you'll have a good description of adolescent and emerging adulthood development and understanding connections between development and mental health concerns. We'll review youth treatment needs and barriers to effective service delivery. We'll discuss strategies for engaging with youth in developmentally sensitive and informed ways, and we'll describe youth-centered and developmentally informed care and how it is relevant to policies, services, and practice in the context of integrated youth service settings. I first want to give a bit of context in terms of thinking about adolescent and emerging adulthood development and how that connects to thinking about mental health concerns. We want to first understand who are Canadian youth, who are the youth who may be most likely to access mental health services. Youth represent about 25% or a quarter of the Canadian population, and youth in Canada are highly diverse. So about 27% of youth in Canada identify as visible minority, and in Toronto and other urban centers, those rates are even higher. So over half of youth in Toronto identify as a visible minority, and this is data that comes from Statistics Canada. About 6% of Canadian youth identify as Indigenous, and the number of young Indigenous people is growing. And there are certainly differences in terms of the percentage of Indigenous youth depending on where youth are located. So in Toronto or other urban centers, those percentages are smaller, and we have higher percentages of young Indigenous people in northern parts of Ontario. In terms of thinking about mental health concerns among youth, data from the most recent Ontario Student Drug Use and Health Survey found that about 34% of Ontario students report that they have experienced or are experiencing moderate to serious levels of psychological distress, and about 14% indicate serious distress. And suicide is the second leading cause of death among youth aged 15 to 24 after accidents. Despite higher rates of mental health and substance use concerns among youth and emerging adults, we still find that youth and emerging adults are not well served by treatment systems. And this is a tricky time in terms of thinking about the transition from child-centered care to adult services, where oftentimes youth fall through the cracks. And there tends to be higher rates of disengagement from services during that transition, so that we lose a lot of our youth in terms of meeting their needs with respect to mental health resources during the period of time in which they most need those resources. So we see higher rates of disengagement from services during adolescence and emerging adulthood. I think it's also helpful just to talk a little bit about terminology, because there oftentimes are different ways of describing youth or adolescence, and we frequently in service systems use age as a cutoff as far as defining different developmental periods. So when we think about adolescence, oftentimes we're talking about individuals who are between the age of 12 to 18, and emerging adulthood refers to those who are between the ages of 18 to 25. Some service systems use the term transitional aged youth, which is meant to describe those who are in adolescence still, so between 15 and 16 years old, and up to 25 years old. And I have this question mark around adulthood because I think oftentimes it's very individually determined as far as who identifies as an adult. So while we oftentimes use age cutoffs as criteria for who can access services, I think we may find many individuals who are over age 25 who don't quite consider themselves an adult, and we may find many individuals who are under age 25 who identify more as an adult because perhaps their context or life circumstances has led to them taking on more responsibilities that are consistent with adulthood. What is really important to consider with regards to the developmental context and how we can ensure we're offering youth-oriented services is that this is a time of rapid change and growth. So we see rapid changes during adolescence and emerging adulthood, and this happens in several domains. There are many changes in terms of the physical self, many changes with respect to cognitive functioning, changes in terms of social relationships and social contexts, and changes with respect to identity. And I'll talk about each of these in more detail. So many of the physical changes that happen during adolescence are a result of puberty. So we're seeing individuals who are experiencing significant growth spurts, and this happens earlier for girls than for boys. There are also significant changes in terms of the amount of sleep adolescents need. So adolescents need 9 to 9.5 hours of sleep, more than they may have needed as children and more than they'll likely need as adults. Because of these many changes with respect to body in puberty, there is also increased self-consciousness, so sort of a greater sense that one's body may look different than other people's body, and oftentimes when we think about the onset of some mental health concerns, that can be associated with self-consciousness, for example, with eating disorders. And there are also changes associated with increased sexual interest and formation of sexual identity. We also see many cognitive changes during adolescence. So adolescents are engaging in more abstract and hypothetical thinking. They're more able to sort of imagine various outcomes associated with different behaviors or events. They may ask more questions about what ifs. And when we think about things like anxiety, for example, that's sort of a disorder that's oftentimes associated with what ifs, this concern around negative events happening. Adolescents are also capable of metacognition, which means they're able to think about thinking, and they're able to engage in mentalization where they can sort of imagine what other people may be thinking or feeling. And when we think about self-consciousness and also sort of considering anxiety and other mental health concerns, when individuals are more able to think about other people's thinking, they wonder more what those other people may be thinking of them, and that can increase their own worries about how they're perceived by others. Individuals in this time of life are also susceptible to sort of the personal fable, that sense that they may be in sort of less vulnerable to bad things happening to them. And this is a period of time of self-focus, so there's not as great recognition around what are potential consequences of behavior. We have a much better understanding of cognitive development in adolescence because of advances in brain imaging, so we know better now than we have in the past, this connection between cognition, emotion, and behavior. And we know a lot more about the reorganization within the brain that contributes to some of the challenges associated with this time of life. When we think about what that reorganization looks like, there's sort of these two systems that are working in a bit of dissymmetry during this period of time. So we have major changes in the limbic system during adolescence, and this is the area of the brain that supports emotion, behavior, motivation, learning, and memory. It also governs reward-based drives, and there are many changes happening in the system during adolescence so that emotions can intensify and become more unpredictable. There's a greater drive towards reward-based behaviors, and there's changes in the fear center, which can also be associated with increased intensity of emotions. At the same time, the prefrontal cortex is continuing to develop. So there tends to be continued refinements in this area of the brain into adolescence, and now it's established that occurs up until the mid-20s. And the prefrontal cortex is responsible for some of the higher order cognitive tasks that we think about when we think about brain development and thinking. So things like judgment and inhibition, decision-making, reasoning, all of those cognitive tasks are associated with the prefrontal cortex. So in some ways, these aspects of brain development contribute to a unique vulnerability to risk-taking that occurs during this stage of life. So there's changes in terms of experiencing more intense emotions and not as much ability yet to regulate those emotions or to use judgment and inhibition of behavior. And as a result, there tends to be an increase in the pursuit of novelty and sensation seeking. And these aren't only due to age differences in cognitive functioning, but also, as I mentioned, with respect to the development of the prefrontal cortex, some of those factors that influence self-regulation. I found this metaphor a particularly useful one in terms of thinking about what's happening with respect to the brain development as well as the physical changes that occur in adolescence and emerging adulthood. So it's as though we're thinking about a race car where there's this big engine of maturing bodies and independence driving that's normal during this time of life. And yet we have an inexperienced driver whose prefrontal cortex is still developing and doesn't quite have sort of the brakes in place to inhibit what may be reward-driven or novelty-seeking kinds of behaviors. And these inhibitory mechanisms tend to be immature because of this time of life. And we also have this high-octane fuel, so the pubertal changes in hormones that tend to drive reward-seeking, and as I said, the intensification of emotions. And so it certainly represents a challenge as far as thinking about the extent to which adolescents are likely to be involved in potentially risky activities without maybe a sense of what some of the consequences of those activities might be. This is also a formative time with respect to social development. So in terms of normal, healthy development, oftentimes we think about increasing desire for independence and autonomy that's associated with this time of life. And there is a need for age-appropriate support from parents, despite the fact that adolescents are spending less time with them. There's also a preference for spending time with peers and increasing intimacy with peers, and relationships are truly critical for comfort and support during all periods of transition, but especially during this period of transition. When an adolescent is struggling with relationships, that can result in them feeling increasingly disconnected and isolated. There may be a narrowing of the social network. And when we think about adolescents who may be struggling in terms of their mental health, oftentimes that can lead to feelings of isolation and withdrawal from relationships. And again, that can be particularly tricky during a time where social support is so important in terms of helping individuals through this difficult transition. And when we think about the research, there's certainly evidence that adolescents and young adults are disconnecting from other people, and they also can have sort of a lack of faith or disconnection from communities or other aspects of social support where they may have had that in place in childhood. So Adolescents and emerging adults are spending more time alone than any other age group except for older adults. They're also digital natives. They've grown up with technology. Social media is fully embedded within their lives, and that can lead to disconnection in terms of in-person relationships, more time spent online as opposed to with other people. And it's an important time for reevaluating values and faith from family of origin. And so oftentimes that can be associated with a disengagement from faith and community, which again may contribute to a greater sense of disconnection and isolation. Adolescence and young adulthood are also a critical time for identity development. So we know from Erikson's early work that this was the period of time associated with identity versus role confusion, and sort of we're thinking about questions like, who am I anyway? What is my place in the world? What do I value? What do I want in my life going forward? And this continues into the 20s before a more integrated set of values becomes established for individuals. There's also a change with respect to the ways in which individuals get external support or get reinforcement. So in childhood, self-worth is often gained through external accolades, and oftentimes that happens through parents or school, where a lot of reinforcement comes from those contexts. But as we get older, there are fewer opportunities for those kinds of reinforcement, and so there isn't as much external regulation. So there can be sort of a loss of self in terms of not having those external factors to reinforce who somebody is, and there's a tendency to then look inward to begin to focus more on identity. And for some, that can lead to self-doubt and intense introspection. When we think about the transition to adulthood, this has been described as an ambiguous waiting period where a person feels very much in between. They're no longer a child and yet not quite an adult. And so there's this sense of not really knowing where one lands with respect to where they're at in their own development. It is a period of time where, as I said, identity exploration is very salient. It's also a time of significant instability for many people. There may be many transitions with respect to school and work, relationships. Individuals who are transitioning into adulthood tend to have a greater focus on the self. This is a period of time before one has the need to focus on other responsibilities like building their own family or stable employment. And so there's more opportunity to focus on self, which, as I said before, can be difficult for some and may increase sense of doubt or wondering where one fits in with sort of larger worldviews. It's also a time of possibilities. So many emerging adults feel very optimistic about what the future holds for them. But with that sense of possibility also comes some experimentation with respect to trying on different identities or trying out different behaviors as part of exploring what might be possible for that individual. When we think about some of the patterns of behavior that occur during adolescence and emerging adulthood, it's important to sort of identify what may be more typical versus less typical types of behaviors that emerge during this period of time. So it's very typical that individuals are going to experience changes in mood, that they're going to be less reliant on parents. That's part of developing autonomy from parents and independence. That they're going to look more towards peers as a source of influence and support, that they will have, that adolescents have increasing interest in sex and sexual interest in general. There is often experimentation with cigarette smoking, alcohol, and cannabis use, and there's that focus on the self, and with that some self-consciousness that emerges as well. What is less typical is that we may see some lack of engagement with school. So while there may be some questioning during this period, a total lack of engagement with school is less typical in thinking about what happens during this time of development. It's less typical to see regular use of alcohol or cannabis versus the experimentation that is more typical. It's less typical to see frequent and intense changes in mood, such as anger outbursts. It's less typical that you might find an adolescent or emerging adult who's fearful about leaving home or leaving parents. And it's less typical to have emerging adults and adolescents who may be struggling with things like self-harm or suicidal ideation or attempts. When we think about some of the additional factors that may increase or decrease the likelihood of mental health concerns, it's important to consider sort of what are those risk and protective factors in the context of this developmental period. So we have a sense of thinking about development and physical, cognitive, social changes in identity as well that occur during this time, but also there can be specific risk and protective factors that may either make one more susceptible to experiencing a mental health concern or can protect against mental health concerns during this time of life. And there are different sources for risk and protective factors. There are individual risk factors, for example, biological vulnerability, where there's a family history of mental health concerns, or prenatal exposures to toxins, for example, or learning disabilities. Life experiences can create sort of a context of risk when individuals grow up in poverty or they're exposed to aversive childhood experiences. Those present as risk factors for the development of mental health concerns, exposure to violence and parental conflict, as well as social and school factors like peer rejection and bullying, as well as frequent school changes, which can lead to difficulty bonding and engaging with school. And community characteristics as well can serve as risk, where there's a lack of community resources, so no opportunity to connect to community supports when an individual grows up in a community where there are high levels of violence or they experience discrimination within their community. And on the other side, there are certainly some protective factors with respect to all of these areas. So an easy temperament in childhood contributes to a less likelihood of developing mental health concern. When there's stability with respect to housing or having a positive role model, and there's supports at transition points, those things are protective. Having secure attachment to a parent or a parent who's authoritative, which means that they are both warm, but also there are sort of rules around how the household functions. And also when parents engage in monitoring, so they know where their kids are and who they're with during their free time. Those things are protective. It's also protective to have supportive relationships with other adults and bonding with school, access to support, and to feel connected to one's cultural identity. This is a good time to sort of pause for some discussion and reflection. So as you're listening to this discussion, I want you to just consider the following information about Jessica. And thinking through in the context of your role and based on what you know about development, to consider what the description says about Jessica and consider how you might engage Jessica, how assessment might go with Jessica, and what care or treatment plan might look like with her. So Jessica is 17 years old. She has been in the mental health treatment system for the past 5 years, and she has been diagnosed with ADHD, depression, and an anxiety disorder. She currently lives at home with her mother, stepfather, and younger half-brother. She has a close relationship with her mother, with whom she immigrated from India when she was 2 years old. However, her relationship with her mother has been more strained since her mother married, which was almost 5 years ago. Over the past few months, Jessica's anxiety and drinking have escalated. There have been several instances of Jessica getting in trouble with a new group of friends due to her drinking, and her mother is warned that she will have to leave the house if she has one more episode of intoxication. The last time she had an assessment, it was recommended that she start a CBT group, but she's been ambivalent about any ongoing treatment. For now, her main reason for coming to your service is her mother's warnings. So this is a good opportunity to pause and think through some of the issues that are presented in the case, and think about, again, how you might engage the youth, what your assessment might look like, and how you might develop a care or treatment plan that meets her specific needs, considering her background and context, as well as the developmental context. I think it's important as we consider developmentally oriented care that we also come at this through a strengths-based lens or perspective. And when we think about services that we're offering youth, we want to focus on wellness and not just psychopathology. And part of focusing on wellness means identifying assets and resources that help promote positive development in youth, and to take a positive developmental framework in terms of thinking about how we can best support youth and capitalize on the many strengths that they bring to the service context. And when we think about positive development, we, service providers and others who work with youth, are really in a position to help youth with respect to focusing on positive identity development, which includes self-efficacy, so really helping youth to come to know their strengths and understand their own sense of competence and capability, and empower youth to use their competence in terms of how they engage with others and engage with activities throughout their lives. We also want to highlight the ways in which youth have the capacity and motivation to make choices and follow through on tasks that are consistent with goals that they identify as personally meaningful, and values that are consistent with how they want to live their lives and how they see themselves. Part of working with youth also involves not just attending to sort of concerns or, as I said, psychopathology, but really helping youth develop skills that build their mastery and facilitate their capacity for adult roles. We want to look not just at what's happening now, but also how we can help youth to build resources that are going to serve them well as they transition out of adolescence and emerging adulthood and into adulthood. And finally, we want to focus on helping youth establish healthy, pro-social, supportive relationships, because relationships are so critical during periods of transition, and that sense of connection oftentimes is extremely important as people go through various stages of life, and to help youth get through challenging times, and again, to continue on that trajectory into adulthood. So let's take another moment here for a different exercise. This is an exercise in finding our strengths. So here, if you are with other people in the room or you're on your own, you can do this exercise either way. If someone is there with you now, I'll ask one of you to think of a story. If you're on your own, you can think of a story about yourself. And this can be any story. It can be a story about something you did yesterday or last week that may have been interesting or funny or descriptive of you in some way. As you think about this story, I want you to reflect on it a little bit. And again, if you're with your partner, you can tell your partner the story, and you'll both reflect on it together. If you're on your own, I want you to think through in what ways this story speaks to you or your partner's strengths. What positive attributes about you or your partner are evident in the story? And then if you were talking to your partner, or even if you're talking to yourself, what are some affirmations or praise you might give yourself in response to this story? How do your strengths come out in the story, and how might you tell yourself or your partner about those strengths based on the story that you've heard? And then maybe we can reflect on what it's like to think about your story in this way. Did it change how you thought about yourself in relation to this event? And if you were working with a partner, what was it like to get some feedback from your partner about your strengths and the strengths that emerged from this story? Part of this exercise is recognizing the ways in which any story that we hear about a person and the ways in which any individual's narrative really speaks to their strengths, and how when we hear people's stories, oftentimes we don't pay attention to the way in which that story tells us about all of the strengths and resources that person has. But when we're working with clients and we have individuals coming in to access our services, it's oftentimes really helpful to listen to those stories and work with the youth to identify the ways in which their stories really speak to their strengths. Okay. As we think about developmentally oriented services, we also want to think about what are the usual pathways to services for adolescents and emerging adults. And the truth is, many adolescents and emerging adults seek services at the request or prompting by others. So oftentimes it's the case that they're encouraged to seek treatment by a family doctor, by parents who are concerned about what's going on for them, or by someone at school who also may be concerned. In other cases, it may be that they're referred from hospitals because youth may be more likely to seek services in the context of a crisis. So we may be more likely to see youth who are either just out of a crisis or still in the middle of a crisis because they've attempted to access service through the emergency department and then have been referred outside of the emergency department for follow-up care. In some cases, we do see youth who are self-referred, so they're coming in on their own, but a lot of the time there are these other sources that are bringing the youth into accessing service. When we're thinking about service delivery, it's important to consider what tend to be some of the barriers to engagement. So here's another opportunity to reflect on your own experiences and to think through what are the main barriers for young people who are accessing your services. And also, what are the main barriers you experience working with young people? And these may be related to your own experience, your own knowledge, skills. I think we all can recognize there are places where we feel like we want to develop more skills or get more knowledge that will help us to ensure that we're providing the best possible care to the individuals we're working with. And also, what are the characteristics of a youth-friendly service in your mind? If you were to sort of imagine the ideal youth-friendly service, what would that look like? And how does it address some of the barriers to engagement that may be more common in services? There has been quite a bit of research on what are barriers and facilitators for treatment seeking among youth. And in terms of barriers, there are many. So oftentimes it may be about service location, that services are located in areas that are difficult to access by youth. That the environment is not quite youth-friendly, so it's not sort of a place where you feel comfortable going, that they feel like it speaks to them and their individual experiences. It may feel very disconnected from their own experience. It may be that youth aren't comfortable with the policies and processes in place. For example, they're uncertain about what the limits of confidentiality are and how that is going to impact what they say or the care that they receive. It may be that youth feel more comfortable relying on themselves, and research has shown that oftentimes youth say the reason they don't access services is they assumed they could sort of figure things out on their own, or that they didn't need the help. They felt like that maybe they could, access that through their own self without getting the additional support from a service. Oftentimes youth have fears regarding stigma and being misunderstood, and they may have had negative past experiences with service systems that have led them to dismiss the possibility that any other experience could be positive or could be helpful to them. On the other side, with respect to facilitators, we see really sort of the other side of that coin. So when systems or services are designed to be youth-friendly, even with respect to the interior design, it's sort of made in a way or decorated in a way that really speaks to youth and that kind of invites youth to come in because it is a youth-friendly environment where youth feel that they are accessing social support and they're encouraged to access services, especially when they have trust in the provider that can help reduce their concerns around trust and confidentiality and their fears around stigma. It certainly is helpful when locations are convenient so that youth can easily access them, and also when there's outreach services embedded within those within the larger service so that youth can be met where they're at, even physically, with respect to being able to access the service. and when there is greater collaboration between services and agencies to ensure that youth aren't falling through the cracks. So when they're involved with other service systems like youth justice or child welfare, when they know that there is going to be continuity with respect to care, this idea of sort of feeling like they don't have to retell their stories, or that they don't feel that there's going to be some disconnect between a system that they have already developed trust with and a new system that they're moving into. When we think about what are developmentally informed interventions, these are interventions that bridge the gaps between child and adult systems of care. So as I mentioned earlier, oftentimes this is where we see youth falling through the cracks, where there isn't an easy transition between those two systems of care, and so youth become disengaged at the point at which they are most in need of services. We want to see interventions that address the full continuum of care, and where there is support of collaboration amongst sectors, as I mentioned before. Services that are developmentally informed are those that address stigma, that are open about services and that address stigma directly, that are youth-friendly and family-sensitive, and that incorporate a health equity lens, where there's targeting of the social determinants of health. And these are also services that are evidence-informed, in that they utilize practices that have real evidence to support their use with respect to effectiveness. And I'm going to talk about each of these in a bit more detail. When we think about bridging that gap between child and youth service systems, we also want to sort of arm youth with the best information that they can have to be advocates for their own self and their own care. So focusing on improving mental health literacy in people involved in young people's lives and improving mental health literacy for young people themselves is a really important part of what we can do at earlier stages to ensure that there isn't anyone falling through the cracks once they're in that phase where they are transitioning from child to youth or emerging adult-oriented services. There also should be some flexibility in the timing of service delivery and sort of a no wrong door policy. So if a youth comes in to access a service, the ideal situation is that they can access that service at the place where they've attempted to access it without being told that, I'm sorry, we can't see you here because we can't meet your needs. We also want to avoid disruptions in service transitions, and so that is part of improving mental health literacy. We want the individuals who are supporting the youth to understand how those service transitions occur to ensure that they happen as smoothly as possible. As far as acknowledging that full continuum of service, this involves thinking about prevention and early intervention and not just intervention at the point of crisis, for example. We want to think about delivering targeted prevention and intervention programs in partnership with other youth-related services. And focus on early or subclinical issues. So as I mentioned before, it's not just about addressing mental health concerns or psychopathology, but looking more generally at skills that are going to serve youth well as far as they're transitioning from child and adolescence into adulthood. And we want to focus on continuing care through treatment and maintenance. So provide kind of an open door where youth can access care or reestablish relationships, even at a time after they may have completed their care or their treatment. Youth-friendly services involve creating positive connections with young people. They involve value, respect, and non-judgment to young people. Really focusing on supporting youth in competence for taking charge of their own health care, so sort of not creating dependency, but arming youth with the skills and ability to take care of their own health. And as I mentioned before, that involves increasing mental health literacy, so youth feel competent and capable and empowered to look after their own health care. It also involves meaningful youth participation in the service, so that youth are involved in all aspects of service delivery, that they feel they have a voice in how services are delivered and run. And it involves meeting youth where they are at, recognizing that not all youth are going to want a certain level of service delivery, and finding ways to ensure that youth can access services even if they're at earlier stages with respect to thinking about how they want to access treatment or what may be helpful for them with respect to treatment. In terms of enhancing collaboration with other services, we want to see services that partner with and support primary and secondary care providers. So this would include homeless youth services, youth justice, child protection, and the medical system. So again, there's not this sense that these are disconnected service systems where youth have to navigate the different systems on their own, but instead they're coming together so that youth feel that there is a somewhat seamless transition with respect to accessing one service or another. And that involves promoting strong inter-service relationships with open communication among services to the extent that the youth feels comfortable with that communication. And where possible, to be able to offer one-stop shop for care so that you can access multiple services within a single system, again, rather than having to deal with multiple service systems and miscommunication that may occur among them, which can lead to increased disengagement and sort of losing some youth in that disconnection between those delivery systems. It's helpful in terms of thinking about where youth are at with their development that we provide family-sensitive practices. The family does continue to be a central component of the social world of youth. And while there is that shift with peer support becoming increasingly important during adolescence and emerging adulthood, family continues to be a central source of support. And so when we think about youth services, we also want to consider how those services can support families through things like family peer support programs and providing some balance between family-sensitive practices while also making sure we meet the needs of young people. So being sensitive to the fact that for some young people, family can be a source of trauma. And so the extent to which families are involved with service may be different depending on those early experiences and where the youth is at and what they feel is going to be most helpful for them. Services also need to incorporate a health equity lens, and that means addressing the social determinants of health, things like gender identity and race, sexual orientation, differences in income and education. We want to ensure that youth-oriented services are removing all barriers that could prevent access to mental health care. And youth-oriented services should be ones that challenge the status quo, that sort of don't just accept usual care for what it is, but instead really, as I said, involve youth meaningfully in the process of developing services so that the service itself is taking on what is going to be most helpful, most promotive of youth independence and autonomy, and truly incorporates youth experience and worldview into the service itself. Youth-oriented service should also establish goals in developmental domains. So we're not just focusing on mental health, but we're really thinking holistically about multiple aspects of development. And when we think about what that looks like for youth, that involves multiple domains. So it may be things like self-regulation, personal self-care. It may be around money management, around accessing work, accessing education, all of the ways in which we ensure that an individual's needs are being met holistically. It also may be addressing some of the habits that can stand in youth's way of executing daily goals. So oftentimes we see youth who may be struggling with healthy eating and sleeping. They may have difficulty with organization and time management skills. They may have difficulty with life skills like money management or accessing resources. And when we think about holistic care, we really want to be providing services that address the multiple aspects of an individual's experience that are going to promote flourishing beyond thinking about sort of a single context, and think more globally or holistically about how we can support youth in multiple domains of their lives. And we also want to think about how we can increase the youth's sense of competence in managing the many responsibilities that come with entering adulthood, so that, as I said, we can think about this not just with respect to managing what's happening in adolescence, but also really considering how we can support youth in making healthy transitions into adulthood. We also consider youth-oriented services that focus on deepening relationships. This is a critical task of both adolescence and emerging adulthood, and it can often be difficult in the context of mental health difficulties. And there are many reasons for this. It may be that there are social skills deficits or social impairments associated with some of the mental health challenges that a youth is facing. Oftentimes when youth are struggling, they engage in social isolation, they sort of withdraw from sources of social support. And many youth who are experiencing mental health challenges may also have other sources of marginalization that contribute to greater feelings of disconnection and isolation. And so when we think about youth-oriented services, we want to consider having peers and professionals acting not just as counselors, but also as support networks and allies who are promoting the youth's development and advocating for youth in multiple areas of their lives. And this can be offered in many different ways. So we want to sort of think beyond the traditional context in which we see support being offered, which oftentimes happens in person, and maybe consider other avenues for providing youth with opportunities to deepen relationships, for example, using online formats for helping to connect with youth and helping connect youth with peers or other professionals. Okay, I'm going to shift to talking a little bit more about youth engagement and a little bit more skills focused in considering youth engagement and what this looks like. There's really two pieces when we think about youth engagement. So one is about what brings people in. I think sort of when we think about the barriers and facilitators to treatment, oftentimes that's what we're talking about, what actually brings somebody into treatment. And then the second piece is about how do we keep youth involved and engaged with treatment once they've walked through our door. So how do we ensure ongoing engagement for a youth once we've gotten to the point that they are willing to access our service at that initial point? So this is similar to the question I asked before, but a bit different in terms of thinking about what you see as the barriers to engagement. So think for a second about someone who was in a position to support you in making a change in your life. And this may have been a teacher, a counselor, a supervisor. And although they were in a position to help you make a change, in the end you rejected their influence. And consider for a moment what were the behaviors of that other person that led to you rejecting their support. So what kinds of things did they do that resulted in you feeling that they couldn't be helpful to you? Now think about a different person, somebody who did have an influence on you making a change in your life. What were the characteristics of that person, and what sort of helped it so that they did have an impact on you? What kinds of things did they do that led to them being helpful and led to you allowing them in to give you the help that you needed at that point? Many of the characteristics that we think about when we think about somebody who's been able to provide us with help or support and who we've wanted to provide us with help or support are consistent with what we think about when we think about motivational interviewing. And I raise motivational interviewing here because it provides a really nice context in terms of thinking about how do we best engage youth in services. And it really is something that can be used across multiple roles. So it's oftentimes used with respect to thinking about a counselor-client relationship, but really it's something that can be embedded within all levels of service delivery. So when we think about sort of the person who the youth meets when they walk in the door, that person also can embody many of the things that we consider important in thinking about motivational interviewing. And motivational interviewing comes from a spirit of emphasizing autonomy support, so really highlighting the ways in which youth are able to make choices for themselves and giving youth the opportunity to make those choices, sort of passing that responsibility onto them so that they feel more capable of being autonomous in their own lives. Building a relationship that's one of collaboration or partnership, and that means not taking on an expert role, really respecting that the youth is the expert in their own experience and eliciting their perspective because we want to fully understand their experience and where they're coming from in order to fully understand what their needs are. As individuals working with youth, we oftentimes want to resist the righting reflex, which is what happens at times where we have a sense that we are working with somebody who may not be on the path that's going to lead to the best outcomes for them, and so we want to jump in and do everything we can to correct their course, but by doing so, we take away their ability to reflect and understand for their own selves what they might need. And so we want to trust in our clients' potential to make changes in their own lives and elicit from them ways that they can make those changes. The spirit of motivational interviewing brings together collaboration, evocation, autonomy, and compassion. And through collaboration and partnership, we understand that as counselors or individuals working with youth, we bring expertise to the relationship based on our own background and experience working with other youth, but that at the end of the day, the real expert in the room is the youth who is the expert on themselves. We work through evocation, where our role is to really help draw out ideas from the youth about what they value, what they feel is going to be most helpful for them. And we evoke those reasons and methods for change by asking questions to elicit from the youth their ideas about what change could look like and how it could happen. And certainly, as professionals, we can offer suggestions, but it's done in the spirit of MI. So it's done with asking permission and first really working to elicit from the youth their ideas before we offer some suggestions that come from our own expertise and experience. We also recognize that the choice to change at the end of the day comes from the youth themselves, that while we may have very good intentions in trying to promote change among youth that we're working with, that it needs to be that the youth themselves recognizes what is important about change and how change can happen. And by recognizing that the change or the choice to change comes from the youth, we're really respecting the youth's right and capacity of self-direction. As part of this role, those affirmations, that strengths-based focus is really important because that's part of what helps the youth to recognize that change is possible and that they themselves are capable of change. And so our role is to seek and acknowledge the youth's strengths so that they too can understand better how they can be effective in making changes in their own life. And all of this comes from a place of compassion, where we're actively promoting the youth's welfare and giving priority to their needs. This takes us to our last slide, looking at a few final questions for discussion and reflection. And so here, it's about considering your role and responsibilities working with youth. There's a few questions that could help guide some reflection. And again, if you're with a group, this is a great opportunity to discuss with each other ways in which you can think about offering youth-oriented services. If you're on your own, it may just be reflecting with respect to your own experience and what connects for you. So thinking through these 4 questions. The first is, what are the key ways your work with youth is framed within the developmental context? Taking in all of what we've talked about today, how is your work with youth framed within that context? And then what are some strategies that you will implement to enhance youth engagement with your Why/Who service? Third, how will you monitor and assess whether your services are, in fact, meeting the developmental needs of youth in your Why/Who community? And then, what are the pros and cons of having parents involved in youth services And in what ways are parents or could parents be meaningfully involved in the services that you're delivering to youth? Take a bit of time to think about those 4 questions and discuss. And I thank you for taking the time to hear the presentation today, and hope that's given you some additional ideas about thinking through youth-oriented service delivery and meeting the needs of youth